Good evening. So nice to see all of you. It's a wonderful opportunity to be together in this beautiful environment. And I thought that rather than our just waiting, we use the time well to interact, because when the CM comes, it'll be a really brief session. So I think that what we can actually do is rather than giving speeches, uh, do like an interactive Q&A. And Madhu and I, those of you who haven't met Dr. Madhu Shashidhar, we're both happy to hear your point of view, answer questions, and more importantly, in the few days that you've been together in the hospital, understand what you feel we should be doing better or differently to really serve the community. So with that, before I throw it open, let me wish all of you the very, very best. I know you're going to have an outstanding career, that you're going to build teams that come together. I think when I first addressed you, I told you that Chairman said that one of the reasons that Mass General was among the best hospitals in the world, and now Mayo, is not just because of equipment and clinical team and clinical excellence individually, but because they all came together in the lunchroom. And they would sit and talk and discuss cases, or they had structured programs to exchange knowledge. But that was 45 years ago. Today you have WhatsApp, and you have AI, and you have many other tools. But nothing is as powerful as clinicians talking together to solve a problem. So very happy to see you, and I think it's a special and a memorable moment. I remember September 18th, 1983, when Apollo Chennai was inaugurated. I remember each one of, whether Apollo Hyderabad, Apollo Delhi, Apollo Bangalore, each one of them. So this is one more significant milestone for us. And thank you so much for being here and making it all special. So over to all of you. Madhu, you want to say a few words before we start? Come.
Thank you, Ms. Sangeeta. I think I've met most of you in different venues, some one-on-one. It's really a remarkable time. I'll just tell you, this past weekend today, I was at the Apollo Health and Lifestyle, AHLL, which is our clinics and our diagnostics AOP, talking about growth. We are talking about how to plan for next year and growth. Today we are doing the formal launch here. Last week on Monday, I was in Bangalore, and we did the launch of our Wellness Hospital, did the Bhumi Puja across. Just recently, we inaugurated Pune Hospital, and then in a month or so, we will open our Kolkata Hospital and Gurgaon right after that. This is truly growth that you're seeing, and it is not just growth to serve more patients and touch more lives, as the chairman said, but it's also growing in the right way, with the right technology investment, with the right group of doctors. And every time we do this, I think we learn a little bit more. I think the last time I sat down with you, both from the nephrology team, there was a great level of feedback, and I think we are going to support true research publication, impactful publication. I think the pulmonary group brought up the need for subspecialty pathology and imaging. I think this is the kind of feedback that Ms. Sangeeta is asking about. Every hospital, every new group of doctors is an opportunity for us to learn. So we'd love to hear from you, hear your feedback the first month or so of operations, and happy to answer any questions, happy to take any notes, and make sure that we are truly meeting your needs. The one thing that I would say is new hospitals are always challenging. Hospitals are dangerous places for patients in any part of the world, more so in new hospitals, new teams, new nurses, sometimes new to the system or new to the profession. This is an opportunity for all of us to set the culture we want. So I would ask each one of you, and I know you're doing this, please take the time. Let's train the nurses. This is one team working together, multidisciplinary teams, multiple teams of doctors coming together, and you will leave the mark on this facility for decades and generations to come. Questions? Any one of you?
Sorry, before we this thing again and hand it over to you, I do want to this thing that it is the 5th hospital in Hyderabad. It is the 76th hospital in the group in terms of location. But it's also, I think, one of our first smart hospitals. Yeah, we can celebrate together. And it's definitely not going to be, we have more coming, more momentum. I want to use one moment to congratulate the team as well. A few hours ago, I thanked Mrs. Sunita, our managing director, because she has a plethora of opportunities. And she said, why should we put more money into Hyderabad? You're already doing Proton. And we said, no, you have to be in high-tech city, financial district. There is a significant thing. So I want to thank them. I want to call out Tejaswi, who pushed this project and I think has worked with all of you, whether it was breakfast, lunch, this thing. Dr. Subba Reddy, who is not here, but as you know, is taking care of sick patients all the time and VIPs. Dr. Ravi, who's going to be partnering with you and making this, he is one of your own. And of course, Harkaran, who had some exciting options and is inspired to make this hospital, Apollo Hospital Financial District, with all your support. He's inspired to make this one of the showcases in terms of high quality, in terms of streamlined patient process, in terms of implementation of AI, in terms of the highest clinical teams working together and building subspecialization. And I think also he has another target of the quickest hospital to financial break-even. So I'm sure all of you will work together to make this happen. So good luck and God bless you all. One of the things which I did say at AHLL is that we have a value commitment. Number one, to always do what's best for the patient and the patient family. That is the primary reason that we exist, to do what's best for the patient. Number two is to treat each other with respect. And that each other is not just the doctors, but all the way down to the housekeeping boy, the OT technician, the nurse, every single one is a critical member of the ecosystem. So please treat them with respect. Share, if their knowledge is not up to date, share with them, share with the team. We will enhance the training programs, but let there be that mutual respect. The third, I think, is to always push for further excellence. You know, more data, more clinical research, more sharing. New cures are coming out every day. And definitely we are part of a larger ecosystem of innovation and discovery. Take advantage of the larger, the training, the education, to become one of the largest centers for DNB training. Make that one of your aspirations. To maybe have startups working here. The robot is one of them. We told the robot company that you should build clinical applications and we should be able to invest in it. So let's think out of the box, let's be creative and make something really special happen. And finally, I think a very important one is academic and knowledge humility. Because it is no doubt that all of you are intellectually superior to everyone else. Otherwise, you wouldn't have got into medical school, you wouldn't have finished. But that intellectual superiority, if you combine it with the emotional superiority, that you understand the pain of a patient even if they don't describe it, that you understand that a staff member, if you smile a little, tomorrow they'll do so much for you. So please combine your tremendous IQ with a lot of EQ. And then let's serve Telangana, this part of the country, this part of the world, in a manner that they haven't seen before. So with this, over to Madhu.
Anybody, any comments? No? Someone wants to say.
Good evening all. I am Dr. Shekhar Reddy Gurala, Head of Anesthesia, this facility. And last March 2nd, I entered into the 25th year of my journey with Apollo Hospital. And I have been enjoying this journey in the patient care and giving the best outcomes with the support of my colleagues, doctors and management. I always believe doctors has to engage with each other in the patient care. That's what will give the best care, and that's what I learned with Apollo Group. Thank you.
Thank you so much, doctor. Thank you for sharing that. I know we have some new doctors. Yes. Yes.
Sorry if you all are having the same problem that I'm having, that people are calling me up saying, Andy, you're having inauguration, mammalni pilvaledu. If you're having that same problem, please let me assure you that we have to build a plan together. Every Sunday for the next 3 to 4 Sundays, we'll create open house. So next Sunday, we'll have the immediate neighborhood with the society presidents. We'll invite the MP of this area, who happens to be related, but also the Honorable IT Minister. The next Sunday, we'll bring more corporates in. So we're going to have 3 or 4 sessions. We're also opening up the place for free health checkups. So please tell people, share with Harkaran all the invitee lists that you want from this area. And we'll make sure that your known people, your family, your friends, everybody gets a personal invitation to come. Sorry, I forgot to say that one. Sorry, Madhu, back to you.
No, thank you. Thank you.
Plan for the next 4 weeks of open house in this place.
I know we have several new doctors. I'd love to hear from one of you. Just first impressions, if you are able to share. Anybody? Any one of our new doctors? Everybody is looking away. As soon as I look at them, they're like, nobody? Anybody? Yes, please. And you're really new. You're really new. Yes.
No. See, I'll share this one is, as Dr. Shekhar Reddy sir has told, when I interacted with majority of the doctors here, or like especially in JH, they are more than 30 years in Apollo, 25 years in Apollo. That gives sort of positive feeling about, okay, this is the organization, you can have trust and be there in this organization. That is one. And the second is the amount of, especially in JH, spiritual this one. Like the moment you enter the temple, in between that gives giving somehow unknown positive energy in the organization. And because of these two, I felt the organization is growing day by day, like the number of hospitals are increasing. So all of us has to work with the same positive energy, and I think we are going to become successful.
Thank you, doctor. Anybody else? Thank you. No one? I'll leave the mic here. If you have any comments, do come up. I'll just add on to what the doctor said, which is a lot about culture. And one of the remarkable things that I've seen, I'm also not that old, not as much as you, doctor, in the Apollo system, 2-3 years now. One of the remarkable things is when we started to implement a lot of the safety measures, culture of speak up, getting the nurses to put in serious safety events when they happen, even when they do not reach the patient, the level to which they participated and the openness with which they participated was pretty dramatic. And having done this now in 3 parts of the globe, I can tell you I've never seen this level of participation when it comes to quality. It is a young workforce. It's a highly motivated workforce. They show up every day wanting to do the right thing. And I think our job would be to encourage them to do that and make it a safe space for them to do that. Because when our nurses go quiet, when they feel that they cannot point out what may be a potential safety issue, then I think we are in trouble. Because most often, like somebody said, human error is a symptom, not the actual cause, right? When a human error occurs, it's a symptom of a systematic problem that put that human in that almost always. So I think my ask of you would be to continue to encourage every single person to participate, to be a champion for patient safety, and to feel that if there is a safety violation in the OR, in the ICU, on the floors, they have the ability to call attention, stop the care, and seek help if they need to. Wish you all the best. I think we'll have more of these events. We do love to have the smaller physician focus groups, so I hope to meet you then, and good luck to everybody.
Check this. Check this. Check this. Sound check. This. Check this. Hey.
Namaste. Today, we gather not just to inaugurate a hospital, but to express our deepest gratitude to the countless patients who have trusted us with their lives.
Check, check.
Check.
Check, one, two.
now begin with this ceremonial lamp lighting. May I request our Honorable Chief Minister, Honorable Health Minister, Honorable MLA, our Chairman, Mrs. Chairman, Ms. Shobhana Kamineni, Dr. Sangeeta Reddy to kindly join us for the ceremonial light lighting.
आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोऽस्तुते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च
We are deeply honored by the presence of our Honorable Chief Minister of Telangana, Shri Revanth Reddy Garu, the Honorable Health Minister, Shri Damodar Raja Narasimha Garu, and Honorable MLA, Shri Erakopati Gandhi Garu. We are truly privileged to be guided by our visionary leadership, our Chairman, Dr. Pratap C. Reddy, Mrs. Chairman, Ms. Shobhana Kamineni, Dr. Sangeeta Reddy, Ms. Upasana Kamineni, whose unwavering commitment continues to redefine healthcare in our country. I extend a heartfelt welcome to our distinguished guests, partners, members of media, and Apollo members. May I request Chairman Sir to felicitate Honorable Chief Minister. May I request Chairman Sir to felicitate Honorable Chief Minister. May I request Dr. Madhu Shashidhar to felicitate Honorable Health Minister. May I request Honorable Chief Minister Shri A. Revanth Reddy Garu to kindly inaugurate Apollo Financial District. Thank you, Honorable Chief Minister. Thank you, Honorable Chief Minister. We are truly grateful for your presence and support. Telangana's aspirations inspire us, and your trust strengthens our purpose. Apollo Hospital's Financial District is a next-generation, multi-speciality facility designed to combine advanced clinical care with a patient-centric healing environment integrated with the latest in technology and innovation. Ladies and gentlemen, may I take this opportunity now to call Dr. Sangeeta Reddy and hear from the visionaries who continues to inspire us and guide us forward. This is going to be a strong fireside chat where we'll hear from the leaders themselves. Dr. Sangeeta Reddy.
Good evening, ladies and gentlemen. Namaste. Today is a very special day. It's actually Mohini Ekadasi. During the Samudra Mantham, today is the day that the Amrutam came out. This is the nectar of infinity. So the God's grace and the CM's calendar enabled us to have this on this special day. So may we be able to take the beauty of that Amritam and give it to people across our communities, across our fantastic state, across the country and across the world. So welcome, namaste and good evening to our Honorable CM, Arumulla Revanth Reddy Garu, Honorable Health Minister, Damodar Rajanarasimha Reddy Garu, our legendary and iconic Chairman, Dr. Pratap C. Reddy Garu, and to all of you who are here this evening, Vem Reddy Garu, our Honorable MLA, senior consultants, doctors, and a spirit and force behind us, Mrs. Reddy. It is such a pleasure to be amongst you. We're going to do this slightly differently. This evening is about hearing from the insights, the knowledge, and the power of these three wonderful people who are sitting with us on stage. So I want to begin by really asking Dr. Reddy, your 76th hospital is here. You began in Chennai in 1983. Chairman Dr. Reddy, can you please share with us, Chairman Dr. Reddy, can you please share, can you please share with us your vision of this journey, the journey of caring? How do you see this unveil over the next few years?
1983, when I started Apollo, it looks as though it was today, because the memories are very, because I did for a single purpose. My patients, I'm a cardiologist, I could do everything in cardiology, but there was no acceptable cardiac surgery program in the country. And then only a small number of people, the rich and the powerful, could spend $50,000 and go abroad. And that's what made me, when I used to lose patients who couldn't afford to go there. One of those days, I saw many I lost. That one, that picture in me, she still comes to the thing. A young man, 38-year-old, who had a wife and 2 children. And when he is lost, when I saw that wife and 2 children, it completely shattered me. I said, this should change. If Indian doctors can do, wonderfully well overseas, why can't we have it here? But it was not easy. I went to Delhi as a student on a round trip. But second time to go for this was not easy. But I'm happy. The government, many trips that happened. All the pleasant thing is when we opened the first hospital by the then President of India, from then on, when we could change the various acts to facilitate hospitals like any other industry. And that's what made India today. I think all of us must feel proud that it's not just Apollo, 76 hospitals. There are another 300 good hospitals in the country who has made India proud. And I told our Prime Minister saying that you can declare India as a global healthcare destination. And then gave him 10 steps how it can do. So, and the second thing I suggested was, the world is shortage of 8 million doctors, nurses, paramedics. And then India has the largest number of younger people. If you can only give an opportunity to that. He accepted both. I called it Global Healthcare Destination and Global Workforce. He only changed the name as Heal India, Heal by India, because he said Susruta did the 750 BC. Thank you. Because of this, today we have all of these hospitals coming up, and I'm sure Heal in India will make India, in my terms, global healthcare India, and the world, people in the world will come to us. Hyderabad is a very important thing for us. I think from day one, when I took that 30 acres, people called me crazy out on the top of a mountain because of the care that we give. We want, the infection should not be there. This is why I took that mountain, and today this is my prestigious hospital. For Telangana, again, this is our 5th hospital. We won't stop here. This year, this is our 3rd hospital in this state, but I promise you, we'll do more hospitals in this state and continue to keep MedCity as a star for the world to see. Because we have everything in that platform. It's just not hospital. We have the IT. Shobhana is sitting there. She made 24/7. Our med skills, home care. All of these branches are all sitting there, and that rehab center. But we'll go into the next development. This hospital is not what Jubilee Hills is. This is one step ahead on technology. Upasana, you made all that mischief to make so I think we'll continue to do that. I only promise to thank the Honorable Chief Minister and the Health Minister saying, thank you for coming here. And with your encouragement, I will. My intention is people should be happier, healthier. Our future vision is 3 H at H. Health, happiness at home. Where all of our programs are working towards this achievement of that health happiness. I'm sure with the dynamism that you've already shown, we'll do more and we'll continue to do it.
So, thank you, Chairman. As all of you know, the vision goes on. So, Telangana is one of the fastest rising states, and in Telangana, the Hyderabad and this area, financial district, ORR, etc., really stands at the intersection of emerging aspirations of people, evolving science and technology, because all those advancements are happening right here. And we are proud of our Chief Minister, of the pace at which we're progressing, and of the joint health policy. So may I request our Health Minister to share with us his thoughts on PPP, how public and private can work together to make a better environment for people. I also want to add that this is the place in Andhra Pradesh, the United Andhra Pradesh, in the village where Chairman was born, that we started the 1 rupee a day insurance scheme. That scheme then came to the police force as Arogya Bhadrata. Then came to the entire Andhra as Arogya Shri. That concept that the whole country can be covered or a whole state can be covered happened here. And with insurance, the private sector developed as well, because there is a funding mechanism. And this was his dream, that people should have access to care, and we can enable it only through insurance. So how can we work further in PPP together, that we serve, and also that we work on scientific innovation and discovery, which I know our Honorable Chief Minister is very committed to.
Thank you, ma'am. It is an honor. After a very long time, I met the chairman. He inspires us.
Yes, he does.
His dedication, his commitment,
Absolutely.
his vision is an inspiration for the generations to come. With regard to the policy of the government, Telangana government, my Chief Minister is very passionate about 2 subjects. One is health, one is education. And these 2 subjects are very near and dear to the common man and the families. He always believes education with skill, comfort, secured, and nutritious food. With regard to health, our commitment is, as ma'am has rightly said, the Rajiv Arogyasri was designed in 2006 and 7. When our government has come, when my Chief Minister Revant Reddy ji is heading the government, there was a commitment that we will enhance the expenditure on the family per year from 5 lakhs to 10 lakhs is one. Secondly, we have revised the rates of all the procedures. We have increased by nearly 20%, which has burdened us to a tune of about 400 crores. And the procedure also, we have increased the procedures to, we have added another 183. With regard to the overall policy of the health, affordable, accessible, equitable health services to the common man is the goal. Today we got about nearly about more than 40,000 beds, whether in the secondary health, primary health, and the teaching hospitals. We got about 35 medical colleges, about 17 nursing colleges. So one side, the teaching hospitals, the nursing, the other side, service to the common man. We are more concentrating on the NCD, non-communicable disease, particularly the diabetes, the cancer, the HT. Moreover, apart from this, the huge runways, highways, accidents, the black spots, we have added about 213 ambulances about 1 year back. We are ready to add another 100 ambulances. And every 35 kilometers, we would like to establish one trauma care. Every 35 kilometers, or the maximum 40 kilometers. Similarly, the screening for those citizens who have crossed 30, particularly with regard to the cancer. And the aim of the government is that 90% of the treatment should be available at the district level. Only 10% at the capital, 90% at the district level. We have started the NCD clinics. We have started the chemotherapy at the district level. We have made cancer a notifiable disease. We are maintaining a registry as per the ICMR norms. In this way, and moreover, recently we have taken a policy to establish another 79 dialysis centers. Already we are running 102 dialysis centers. We are going to start another 79 dialysis centers under the PPP model. So our concentration is on NCD, keeping in view the referral system. Somewhere we are weak in the referral system, whether it is the PSC, whether the PSC, the CSC, the area hospital, or the teaching hospitals. The first and the primary thing is the referral system should be strengthened. The overall policy of the government with regard to the health, where the government is uncompromised. With the government is uncompromised, we want to, today almost 140 crores we are spending every month on our Arogyasri. 140 crores, where the share of the private hospitals, empaneled hospitals is about 50%, and the share of the government is about 50%. And we want to strengthen the secondary health. In 1986, the then Chief Minister, N.T. Ramarao, had brought in the Vaidya Vidhan Parishad. It was a long cherished dream of the doctors who are working in the Vaidya Vidhan Parishad, that they want the treasury salaries. They want an assurance, a legal protection. And my Chief Minister was very keen that we should convert it into a secondary health. And we have successfully brought the bill. We have brought in an act. Now we are framing the rules. So for the government, the secondary health is the most important sector. So we got an overall vision for the common man with regard to the health.
Thank you so much, Andy. That was so meaningful. I think every point that you were saying, I know that our chairman was thinking, yes, this is something. So whether you spoke about the emergency services, he was the first one to convert the concept of casualty into emergency service. In Hyderabad was launched the first wireless connected ambulances. We are privileged, I'll hand over to you in a minute, Chairman. In one sec, we're privileged to do 7 of your highway emergency, and along with the national policy, we will be happy to do highway emergency programs. on education, training, postgraduate teaching, research. Each one of these offer opportunities because the talented clinicians are sitting here. You spoke about notifiable disease of cancer. The seminal paper on notifying cancer came from one of our doctors in Chennai. But I know the chairman's biggest passion subject is non-communicable disease and screening. So Chairman, would you like to please share your vision on prevention? And of course, anything else.
I just wanted to say about the casualty. I remember the day before the president was to inaugurate the hospital, as I drove in, I saw the board, red board, casualty. So I went to them and then said, "Our patients come here to become casualty for you? This is terrible. I want this name to be changed as emergency." So we changed by that night, they changed the emergency, and I'm happy. The whole country, it's all now emergency, and they're giving that level of treatment. The second thing I wanted to say is I come from a small village. We look after about 50,000 people in that mandal. For 40,000 people, we look after the complete total health. There is no neonatal or maternal mortality in Tavanambali taluk of Chittoor district. And even during COVID, their mortality was 0.8% like any place anywhere in the world. I think this is what we want to do as a social service. Another thing I want to say is, I did not mention, our next focus is continue to do the curative process, adopting the latest technology, but we must prevent these non-communicable diseases, all four of them, heart attack, stroke, cancer, diabetes, infection, all of them need not die if you can diagnose. This is why we want our thrust is preventive health. Preventive health, we named it as Mass Health Checkup, Apollo Health Check. Today it's called Pro Health. It will reveal early enough so that you can detect the disease and ask him how we can prevent the attack or detect and cure it early. Cancers early can be cured. We have done that, and in the same, this one, as an opening before the Chief Minister and the Health Minister, I want to say that we want to do 10,000 on Sundays, 10,000 free health checkups for people in this area. And another major announcement, first time for the country I'm going to announce, saying Apollo never sleeps. You know what that means? Every Saturday, every Deepavali day, every Telugu New Year's Day, on all days, Apollos will work as a normal day. Because, you know why? Disease has no holiday. Disease doesn't have time. It has no holiday. So we will work 24 hours, we have emergency, but we will have continuously from here. I'm happy to announce before the Chief Minister and the Health Minister, but this is the announcement which is effective from May 1st, that all our hospitals will work on Sunday like any other normal day. All surgeries, everything will be done as normal. They are all ready, and all the hospitals are prepared. Every doctor, every member of Apollo family have all agreed for this date. May 1st will be. So I think two important things is we want people around us to feel healthy and happy, and so that free checkups of 10,000 free checkups. The number, of course, came again from Upasana. So we'll have the free checkups done for poor people, and then do, open up some days, Sundays. Thank you.
So, thank you, Chairman. So all of us are so aware that prevention is something that's so dear to his heart. So 10,000 free checkups for the people around this area. There's a registration process. This will happen on Sundays. And I'm sure all the talented doctors in this room are going to help cooperate to make this a major reality. Thank you all. Each one of you are, a doyen in your field, you're skilled, you're talented. We have robotic surgery, we have transplant specialists, we have subspecialists, and everyone will come together with the dual vision of curative and preventive healthcare. Now, our Honorable Chief Minister, he stormed into the stage and made impact like none other. He has transformed so many areas. We're all proud of you, sir. One of the areas which is very, very close to his heart, besides the schools and the education, is youth. So on this fantastic occasion, we also want to announce that a hospital of this nature, 400 beds, directly employs almost 2,000 people. So healthcare is a socio-economic engine. So sir, you have just inaugurated the addition of 2,000 direct beds and approximately 10,000 additional jobs in your state for your youth. And I know this is critical for you. But beyond that, you have also inspired us to do so much more. So we will continue to partner. And now, on this special occasion, we look forward to you please sharing your vision of how we can work together, partner further, and also your message to our doctors and our team.
Thank you, Sangeeta Garu, Pratap Reddy Garu and Apollo team. మీ అందరికీ అపోలో హాస్పిటల్ ఫైనాన్షియల్ డిస్ట్రిక్ట్ ప్రారంభోత్సవ సందర్భంగా శుభాకాంక్షలు. 46 సంవత్సరాల క్రితం చెన్నైలో ప్రారంభించిన అపోలో హాస్పిటల్ 150 బెడెడ్తో స్టార్ట్ అయింది. 46 years జర్నీలో 76th unit you have inaugurated. Apollo is a role model for the country. All these years, Apollo has created hundreds of hospitals in different names. That may be AIG, that may be Yashoda, that may be anything. That may be anything in India, I can say proudly. Pratap Reddy Garu has designed like anything. He has shown a pathway to how to build a corporate hospital for a layman, poorest of the poor, who can get a better treatment with the minimum charges. So he has laid down a roadmap. That is the biggest task in India. We don't have any infrastructure. As long as we were in closed economy, we don't have any source to start any corporate system. So Apollo and Pratap Reddy and his 4 daughters, I wanted to appreciate Pratap Reddy Garu. Real woman empowerment he has shown. His 4 daughters, Preeta, Sunita, Shobna and Sangeeta, 4 pillars of the hospital, Apollo. So woman empowerment అనే దాన్ని చాలామంది మాటల్లో చెప్తుంటారు. ప్రతాప్ రెడ్డి గారు కేటగారికల్గా వాళ్ళ కూతుర్లను ఒక ఎంటర్‌ప్రెన్యూర్స్‌గా ఈ సమాజానికి ఉపయోగపడే బాధ్యత గల పౌరులుగా తీర్చిదిద్దినందుకు వారిని మనస్ఫూర్తిగా నేను అభినందిస్తున్నాను. అపోలో అనే పదము నాకు తెలిసి వారు పెట్టింది కాదు, వారి కూతురు సునీత సజెషన్స్తోని అపోలో అనే పదాన్ని ఈ దేశానికి అందించింది. అపోలో అనే మాట కోట్లాది ప్రజలకు బాధలో సమస్యలో సహాయం ఆశిస్తున్న వాళ్ళకు ఒక ధైర్యం, ఒక గుండె ధైర్యం అపోలో అనే పదం. యాక్సిడెంట్ కాగానే, యాక్సిడెంట్ అనేది ఎంత కామన్ పదమో అపోలోకి వెళ్దాం అనేది కూడా అంతే కామన్ పదం. ఎవరికైనా ఒక ప్రమాదం జరిగితే సో ఈరోజు ఎన్ని స్లోగన్లు ఎంతమంది వచ్చినా స్ట్రక్చర్ ఫౌండేషన్, he has created that structure and foundation. Now people are building floor by floor. సో సమాజానికి ఆదర్శంగా నిలబడి సమాజంలో ఒక గొప్ప పాత్రను పోషించిన అపోలో యాజమాన్యాన్ని ఈరోజు 3rd generation ఉపాసన కూడా షీ ఈజ్ కంట్రిబ్యూటింగ్ లైక్ ఎనీథింగ్. షీ ఈజ్ ట్రయింగ్ టు బిల్డ్ దిస్ అపోలో హాస్పిటల్స్. నేను December 23లో పొజిషన్ తీసుకున్న. December 28 వరకు ఫస్ట్ టర్మ్ ఆఫ్ చీఫ్ మినిస్టర్గా ఉంటా. సో ఆ ఫస్ట్ టర్మ్లోనే మీరు 100th హాస్పిటల్ స్టార్ట్ చేసి ఆ ఇనాగరేషన్కు నన్ను పిలవాలని. సో ఐఎమ్ ఫిక్సింగ్ యూ టార్గెట్ 2028 December 3rd lopala, you have to reach your 100th hospital of Apollo in the country. Maybe in Telangana, maybe in Andhra Pradesh, maybe in Bangalore, maybe in Delhi. I don't mind anywhere. Apollo is going to serve for the nation. Now the brand is national brand, international brand. We are trying to build the ecosystem. We have taken a policy, medical tourism policy. All these years, Telangana doesn't have any policy for medical education department. Now we have adopted our policy. Based on that policy, we wanted to improve, we wanted to give opportunities to invest, to expand their services. Hyderabad is the place for medical tourism. So I've spoke to aviation minister. People wanted to come to Hyderabad, but they don't have direct connectivity from Middle East countries, some of the countries. They have told me that. So I've discussed with Prime Minister and aviation minister. From Middle East to even Bangalore, Calcutta, we need more direct connectivity. So we are trying to get that, and we wanted to create a health, tourism, medical hub. So we are going to construct a future city. We are trying to construct a future city near to airport in 30,000 acres. There we have earmarked for the medical facilities with international standards. And we are interacting with airport authorities to give green channel for patients. They need not to stand in the line of the permissions and other clearances. They have to give single clearance. They have to allow ambulance up to a flight. Then the patient is going to get easy access. All these issues we have noticed. We wanted to take up next level. మనకి ఫార్మా హబ్ ఎందుకు వచ్చింది అని అంటే 1960s, 70sలోనే ఐడిపిఎల్ ఇక్కడ ఇందిరాగాంధీ గారు ప్రారంభించడంతో నౌ వీ హ్యావ్ సీన్ రెడ్డి ల్యాబ్స్, అరబిందో, నాట్కో, యూ నేమ్ ఇట్ ఎనీ, ఇండియాలో ద బెస్ట్ ఆఫ్ ద బెస్ట్ ఫార్మాస్ ఎందుకున్నాయంటే ఇక్కడ జీనోమ్ వ్యాలీ. అవుట్ ఆఫ్ ఫోర్ కోవిడ్ వ్యాక్సిన్స్ వీ హ్యావ్ ప్రొడ్యూస్ 3 కోవిడ్ వ్యాక్సిన్స్. సో ఆ రోజు ప్రభుత్వం తీసుకున్న ఒక విధానపరమైన నిర్ణయాల వల్ల ఫార్మా హబ్ 40% బల్క్ డ్రగ్స్ ఎక్స్పోర్ట్స్ మన స్టేట్ నుంచి జరుగుతాయి. ఇండియాలో నుంచి ఎక్స్పోర్ట్ అయ్యే బల్క్ డ్రగ్స్లో అవర్ కంట్రిబ్యూషన్ ఈజ్ 40%. ఈరోజు ఈ దేశంలో వైద్యం అందించే దాంట్లో కూడా మోర్ దాన్ 50% తెలంగాణ నుంచి ఉండాలి అని అంటే ఈ హాస్పిటల్స్ కానీ ఇవన్నీ అభివృద్ధి జరగాలి, బెస్ట్ ఆఫ్ ద బెస్ట్ ఫెసిలిటీస్ రావాలి. దీనికి సంబంధించి రాష్ట్ర ప్రభుత్వం తరఫున ఎలాంటి ఆలస్యం లేకుండా, విధానపరమైన లోపాలు లేకుండా మా ప్రభుత్వం నిర్ణయాలు తీసుకుంటుంది. నేను చాలా సందర్భాలలో నా కొలీగ్ దామోదర్ రాజనరసింహ గారి గురించి నేను చెప్తా ఉంటాను. బై ఎడ్యుకేషన్ ఈజ్ ఎ ఇంజనీరింగ్ గ్రాడ్యుయేట్, బై నేచర్ ఈజ్ అన్ సోషల్ డాక్టర్. ఈ నో హౌ టు ట్రీట్ ఎ డిసీజ్. ఆ పాలసీలో రెగ్యులర్గా నా దగ్గరికి ఎవరికైనా కొత్త అంశాలు చెప్పడానికి వస్తే నాకు కొత్త నేర్చుకునేంత సమయం కానీ సందర్భం కానీ లేదు. మా దామోదర్ రాజనరసింహ గారి దగ్గరికి వెళ్తే ఆయన నేర్చుకుంటాడు, అర్థం చేసుకుంటాడు, మాకు అవసరమైనప్పుడు సపోర్ట్ చేస్తుంటాడని. మీ మెడికల్ అండ్ హెల్త్ డిపార్ట్మెంట్ యాజ్ ఎ మినిస్టర్గా ఒక సోషల్ డాక్టర్ని మా ప్రభుత్వం అపాయింట్ చేసింది. మీ ఎవరికి ఏ ఇష్యూస్ ఉన్నా కూడా డైరెక్ట్గా దామోదర్ రాజనరసింహ గారిని రీచ్ అవ్వచ్చు. ఈ ప్రభుత్వం ఎప్పుడూ మీకు అందుబాటులో ఉంటుంది. ఈ ప్రభుత్వం ప్రోత్సహిస్తుంది. ఈ ప్రభుత్వం మీ పెట్టుబడులకు భద్రత కల్పిస్తుంది. భద్రత కల్పించిన మీ పెట్టుబడులకు లాభాలను చూపిస్తుంది రాష్ట్ర ప్రభుత్వం. మీరు తెలంగాణ means business, come and invest and serve the state and nation. Thank you.
That was fantastic, Andy. Thank you so much.
Sir, we have a special recognition. We are deeply grateful to Ms. Upasana Kamineni for her inspired introduction of biophilic design, which has transformed the hospital into a space of serenity and purpose, where clarity in care and calm in every step are not just ideas but a lived experience. So I would like to call Ms. Upasana Kamineni on stage for a special recognition from CM Garu. I request CM Garu, Chairman Garu, and Health Minister Garu, Dr. Sangeeta Reddy, to felicitate Upasana Kamineni.
Good evening. Honorable Chief Minister Sri Anumala Revanth Reddy Garu, Sri Damodar Rajanarasimha Garu, Honorable Minister for Health, Medical and Family Welfare, Dr. Pratap C. Reddy, Founder and Chairman of Apollo Hospitals, Dr. Sangeeta Reddy Ma'am, Ms. Upasana Kamineni, distinguished guests and members of the media. It's my honor to close this special occasion's proceedings with a word of thanks, a genuine expression of gratitude from everyone at Apollo who has worked to bring this hospital to life. Honorable Chief Minister, sir, your presence here today carries significance well beyond the ceremonial. Today's occasion is a reflection of your commitment towards healthcare and education, which are the two pillars the government focuses upon. Honorable Health Minister, sir, your presence here today is deeply valued. You have been closely engaged with strengthening healthcare in this state, and we look forward to continuing our partnership with the government of Telangana. We are deeply grateful to our chairman, Dr. Pratap C. Reddy, sir, without whom none of us would be here. Thank you, everyone.
interest